Hi guys, so in today's lecture we will talk about tuberculosis. In tuberculosis we particularly talk about mild grade fever with evening rise. Why this evening rise? This evening rise is not because the bacteria becomes romantic in evening hours. This evening rise is in fact due to physiological variation of body temperature during morning and evening hours. In evening hours temperature is higher as compared to morning hours, and this bacterial infection adds few degrees to already increased temperature during evening hours, resulting into subjective feeling of fever, particularly during the evening hours. Now let's discuss treatment of pulmonary tuberculosis. Nowadays treatment of tuberculosis will depend on whether a person is having drug sensitive tuberculosis or drug resistant tuberculosis. Try to understand. Nowadays treatment of tuberculosis is based whether a person is having drug sensitive tuberculosis or the person is having drug resistant tuberculosis. Later on we will need to figure out whether this person is having MDR, TB, XDR, that is type of drug resistant tuberculosis. Now who is drug sensitive? See, nowadays we have 4 first line oral anti-tubercular drugs. If your mycobacteria is sensitive to all these first 4 oral anti-tubercular drugs, then it is labeled as drug sensitive tuberculosis. So let's talk about oral first line anti-tubercular drugs. So it is your HREZ, that is your Isoniazid, Rifampicin, Ethambutol and Pyrazinamide. If your bacteria is sensitive to first line anti-tubercular drugs, it is labeled as drug sensitive tuberculosis. And in case of drug sensitive tuberculosis, treatment duration is of 6 months, and you can divide this treatment duration into intensive phase and continuation phase. So on one hand you have intensive phase and on the other hand you have continuation phase. In intensive phase you have to give all these 4 drugs, that is HREZ, for the period of 2 months. Whereas in continuation phase you need to give these particular drugs, that is HRE only, not Z, for the period of 4 months. So total duration will be 6 months. And whenever you happen to give isoniazid, you have to add pyridoxine as well to prevent the peripheral neuropathy, okay, plus pyridoxine. So this is treatment of drug sensitive tuberculosis.